Imagine walking into the theater, not for a play, but for a life or death performance. The year is 1840. There is no anesthesia, no antibiotics, and the star of the show is a man who can cut through a human femur in under 30 seconds. His name was Dr. Robert Liston, and he was the fastest knife in London. But one afternoon, his speed, his greatest pride, led to the most statistically disastrous surgery in human history. One patient went under the knife and 3 people ended up dead. Today, we are looking at legend of 300% mortality rate. To understand how this happened, we have to look at the heroic age of surgery. Before the 1840s, surgery was a last resort. If you had a mangled leg, you didn't have the luxury of going to sleep. You were awake, held down by 4 strong men, feeling every vibration of the soul. In this world, speed wasn't just ego, it was mercy. The faster the surgeon, the less likely the patient would die of shock on the table. Enter Robert Liston. He was 6'2", abrasive and incredibly talented. He used to shout to the gallery of the medical students,
"Timing, gentlemen, timing!"
As he pulled his watch, he was the rock star of University College Hospital. But speed has a shadow side: precision. The case was a simple leg amputation. The patient was trapped, the crowd was hushed, and Liston was ready. He wanted to beat his own record. Liston brings the knife down. He's moving so fast, his arm is a literal blur. In his haste to clear the thigh, he doesn't just cut the patient. He accidentally slices through the fingers of his own surgical assistant, who was holding the patient's leg steady. Liston swings the knife back up to switch tools. A distinguished spectator, an elderly doctor watching from the front row, is standing too close. The blade rips through the spectator's coat tails. Now imagine the scene. Blood is everywhere. The assistant is screaming because he has just lost his fingers. The patient is screaming because, well, he's having an amputation. And the elderly spectator, he collapses to the floor. You might think, okay, a messy surgery, but they lived, right? Wrong. The spectator, he died on the spot. It turns out he wasn't actually cut, but the shock of seeing the bloody knife rip through his clothes convinced him he had been disemboweled. He suffered a massive heart attack and died of pure terror. The patient, he survived the surgery, but in the 1840s, clean wasn't a concept. Liston's equipment and the wound were soon tethered with gangrene. He died a few days later. The assistant, because the knife that cut his fingers were the same one used on the patient's infected leg, he contracted the same infection. He died of sepsis shortly after. 1 operation, 1 leg, 3 funerals. It is easy to look back and call Liston a butcher, but the truth is more complex. Liston was actually one of the first surgeons to experiment with ether just a few years later. He wanted his patients to suffer less. This bizarre tragedy became a turning point in medical history. It highlighted that speed couldn't replace safety, and it paved the way for 2 most important inventions in surgery: anesthesia and Joseph Lister's antiseptic techniques.